Chetty. I'm with the Fiji Women's Rights Movement, based in the Pacific Island region. And I'm here speaking to you as a sexual and reproductive rights advocate. It's very hard to follow on from such an eloquent and very interesting talk of Dr. Tan's presented by Lester. But I'll do my best to share a little bit of the experience in Fiji. So, next slide, please. The Pacific Island region stretches across a large part of the Earth's surface, connected by the world's largest ocean. But the region has often been marginalized in global debates, including on sexual and reproductive health rights, because of its relatively small population. The Pacific can be expressed as many different political formations, sometimes including the nations of the economic north, Australia and New Zealand, sometimes including the French territories. Yes, we still have colonies in the Pacific, and sometimes only the independent nations. Within the region, we often speak of the Pacific Islands as the 22 island countries and territories served by the Secretariat of the Pacific Community. This ranges from the largest island nation, Papua New Guinea, with a linguistically diverse population of over 7 million who speak more than 800 indigenous languages, to the more culturally homogeneous small island developing states of Kiribati, Nauru and Niue, the latter of which has a population of less than 2,000. Given this diversity, there is an accompanying wide range of sexual and reproductive rights issues which are experienced differently by differently situated Pacific Islanders. But first, the question before us is, how do they experience them in crisis and in ordinary times? But my question is, what is crisis? Large-scale humanitarian disasters are clear. The tropical typhoons that have so devastated this country, Fiji's 2012 floods, which you see a photograph here, the tsunamis in Samoa, the Solomon Islands, and of course in Aceh. But what of everyday ongoing crises? These are some of the ones which Dr. Tan spoke of, but there are others also in the wider nation-state context. For example, in Fiji, the military coup and the ongoing military-backed government, which has been in place since 2006, which affect, of course, how rights can be advocated for and realized. The astronomical rates of gender-based violence, extractivism, the large-scale mining it brings, and those pressures and challenges which result in internal conflict. So, even in apparently ordinary times, there are these extraordinary pressures on and challenges in the way of realizing sexual and reproductive rights. I'll just focus on a couple of critical issues in 3 areas. Around the access to comprehensive and integrated sexual and reproductive health services. I'll touch on the specific sexual and reproductive health needs and rights of young people. And I'll look at the interlinked sexual and reproductive rights issues across the Pacific. To begin with, sexual and reproductive health services continue to be underfunded across the region, despite an influx of resourcing around HIV prevention over the last decade or so. This is because integration of services has been poor. And this is nothing new to you. We've heard it repeatedly here in plenary and in all the other sessions. For us, there's less attention paid to contraceptive information and delivery and other SRH services, often in relation to HIV prevention rollout. Go back. Thank you. One of the issues that cuts across many of these is the issue of disability. For the Pacific, like many other sub-regions, we're failing to provide accessible services for those with disabilities. Disabled persons, particularly women, face additional barriers in accessing the limited services available. Now, this goes far beyond the physical and speaks much more to what Dr. Tan was referring to, and the unwillingness to address the sexuality of disabled persons or to recognize them as sexual beings, particularly for women. There's, of course, a lot more to say on this subject, but I'd like to move on to talk about the HIV effect in the Pacific. which is another issue around delivering rights-based services. The discourse around HIV has, of course, been very important in the Pacific. It's opened up, as elsewhere, conversations about sex and sexuality, about men having sex with men, sex workers, and getting to know condoms. Also, there's been really important work done in the Pacific, particularly in the most high prevalence country, Papua New Guinea, which is now no longer facing exponentially climbing prevalence rates. Yesterday we heard from Dr. Glenn Moller that rates have stabilized and things are looking a little optimistic. But with the low prevalence of HIV in most of the rest of the Pacific, which sits at less than 0.1%, for example, Fiji is the second most, has the second highest rates of HIV, and there are just a little under 300 persons known to be living with HIV, as opposed to the many thousands known to be living with HIV in Papua New Guinea. So, successes in policy and resourcing in this area have often come at the expense of other basic sexual and reproductive health services because of this lack of integration. We are now moving into an era of some changes to funding, cuts or changes in the mode of delivery around HIV funding. And the reintegration that's happening isn't ideal. We're simply collapsing back into antenatal care with some STI protections. Serious gaps will worsen, particularly in relation to adolescents. The Family Planning International in New Zealand has identified some key barriers to the effective integration of HIV and other sexual and reproductive health services in the Pacific. There's persistent conceptual divisions, weak national policy to deal with this, inadequate and inequitable funding. Civil society advocacy and political will has been weak, and there is resistance to reintegration. And again, Dr. Tan describes some of this resistance, for example, in bringing anything sexual into dealing with reproductive health. Clearly, we need better integration of these services, which should be comprehensive, gender-sensitive, non-judgmental, and youth-friendly. We need increased funding for sexual and reproductive health services as part of increased health and social spending overall, and better alliances between human rights advocates and those working in the health sector in the Pacific Islands region. Of special concern are the needs and rights of young people, particularly when it comes to the Pacific, where almost half the population is under the age of 25. Situated in island societies where the most conservative interpretations of culture dominate, young people face systematic discrimination in relation to their sexual and reproductive rights. Within this youth population, young women and girls, young people with disability, lesbian, gay, transgender, queer and intersex young persons face additional barriers in accessing their rights. Yesterday, Nauru Tanga of the Cook Islands shared a real-life, very everyday example of how the conservative cultural and religious context limit young people's rights through the violation of confidentiality around anything related to pregnancy, sexuality, sexual health, and reproductive health, and the lack of access to those very basic services. Clearly, we need to recognize and address the diversity of young people in SRHR programming, unpack the arguments about culture and tradition, and resist those simplistic definitions of culture that restrict young people's access. We need to prioritize comprehensive sexuality education for young people and support initiatives by young women for young women, which are particularly important. A lot of this, in terms of services, boils down to the training and retraining of healthcare professionals. Dr. Glenn Moller shared an example of a mobile reproductive health training unit, which could provide a best practice example for other Pacific Island countries, and we wish that initiative well. Moving on to looking at rights in general. The Pacific has some of the highest rates of gender-based violence in the world. Violence is a direct violation of bodily integrity and autonomy. and as such is a complex cross-cutting issue that affects other interlinked sexual and reproductive rights. This gender-based violence flourishes within patriarchal hierarchies in the Pacific, where women, and particularly lesbian, gay, bisexual and transgender persons, face discrimination, which is further inflected by their socioeconomic status, ethnicity, disability, and place of origin. Are you from the city? Are you from the outer islands? It all makes a huge difference. Arguably, the most difficult sexual and reproductive rights issues are the lack of access to safe and legal abortion, the restriction of rights in relation to sexual orientation and gender identity, and discrimination and violence against sex workers. What's needed at the moment is research on abortion in the Pacific to fill the massive void in information, and this was something also highlighted in the first day's plenary. We need to identify regional champions for rights in relation to sexual orientation and gender identity, still a much marginalized area. We need to conduct rights-based research on these LGBTQI persons, particularly lesbian, bisexual and trans women who have been somewhat invisibilized, often even in dealing with sexual health. To continue efforts to gain formal equality for sex workers by decriminalizing sex work in accordance with our international human rights commitments, and to research the point where bodies, ecology, and economy meet, sexual and reproductive rights in relation to the upscaling of extractivism in the Pacific. But let's move on now to end with some good practices. One of the best examples for us in the Pacific at the moment of relevance to sexual and reproductive rights advocacy is a re-energizing of working in coalition across the region. Ironically, often Pacific Island advocates have much stronger links to their counterparts in Asia and Southeast Asia rather than amongst each other across island nations. And part of this is how we are so geographically isolated, part of it is language constraints, amongst other issues. So a loose sexual and reproductive health rights coalition has formed, which has been taking the issues and pushing the envelope further in the region. This group, made up of the Fiji Women's Rights Movement, Dawn, PTI, Cook Islands Counseling Centre, the Pacific Youth Council, and Diva for Equality, a lesbian collective, based their work on the outcomes of a feminist strategy meeting in February last year, where the voices of young women, women with disabilities, and trans women were heard. They brought together 32 key Pacific feminist, women's, and young people's human rights advocates from 9 countries. Their now widely travelled outcome statement listed the key sexual rights issues for Pacific women. And among many other issues, it stated, "We stress that bodily integrity and autonomy is at the core of all work on SRHR and gender equality advancement in the Pacific region. Women and girls are sexual beings and have a right to enjoy their sexuality. Therefore, we call for the international adoption of sexual rights as human rights and reaffirm the protection and promotion of reproductive rights as human rights." They took that message with them to a meeting of Pacific parliamentarians in August 2013. These parliamentarians were preparing for the Asia-Pacific Population Conference later that year. Their outcome statement, the Moana Declaration, made in Suva, included the commitment to advocate to prioritize adolescent SRHR, including through comprehensive sexuality education, and establish accessible sexual and reproductive health and mental health services for youth. It doesn't sound particularly groundbreaking, but it is. If you know how hard it is to get Pacific parliamentarians to talk about sex, these bravely went beyond to actually talk about the need for adolescents to talk about sex, to get that comprehensive education, and as well as accessible services, including mental health services. They took that commitment even further and continued to work together to stand by the Moana Declaration at the 6th Asia-Pacific Population Conference in Bangkok in September, where their leadership helped produce a progressive document committing to sexual and reproductive rights, including non-discrimination on the basis of sexual orientation and gender identity, among other important commitments. Of course, we have many challenges ahead of us in 2014 when it comes to advocating for sexual and reproductive rights, and there's a long road ahead for Pacific leaders if they want to stay true to the commitments they made in Suva and in Bangkok. We also recognize, of course, that the translation of these rights into the lived realities for young women and girls and other Pacific Islanders and those from the Asian region is also a much bigger challenge. Clearly, there's a lot of work to be done, whether it's improving our rights-based immediate responses to a large-scale humanitarian disaster or addressing the everyday, quiet, vicious crises that prevent us moving towards the realization of our sexual and reproductive rights for our Asia and Pacific peoples. But that's the challenge before us, and I wish you all well.